All right. Well, I bet we'll have a couple people trickle in, but I'm going to start recording. And hi, everybody. Thank you for joining. My name is Julia. I am the events manager at Maine Cancer Foundation. And this is our first Try for a Cure camp session. Those who've been to Try before know that we do clinics every year. We weren't able to do them last year, but when we were thinking about bringing them back this year, we were like, let's kind of rebrand them and make them more fun. So we're calling it Try for a Cure Camp. And we're gonna have a lot of sessions in person. Those will start, the first one's in May, but check those out if you haven't already signed up for them, especially the swim clinics. I have a feeling those will fill up quickly as people start training and the weather gets a little bit nicer. So if you head over to tryforacure.org, you can sign up for those. And I just want to say thank you so much for being here tonight, but also for trying. I know, Dana, you've been trying for a cure for a long time. Aislinn and Shara, I don't know. You guys aren't familiar names. Is this your first or your second? First? Oh, wonderful. Welcome.
I did the virtual one last year. So.
Oh, fabulous. Okay, yeah. Cool. So we haven't gotten to see you guys in person yet, but hopefully that will change next year. And in the meantime, thank you for being here virtually. It's obviously a difficult year for everybody, and Maine Cancer Foundation has continued, despite everything, to fund our normal work geared around fighting cancer, and we've also adapted to address some of the problems created by COVID, whether it's making sure people still have rides to treatment who maybe don't have those rides because of COVID. We have been able to, right now we're really focusing on getting people back to screenings because so many people have not gone into get screenings, whether because facilities are closed or they're not comfortable. And obviously cancer doesn't stop because of COVID. So our work is more important than ever, and we are so grateful to each of you. That said, if you have friends or family members who you think might be interested in joining us this year, please send them over to tryforacure.org. We are definitely welcoming more people. You can change to a team this year, so you could either grab a sister, a friend, a coworker, and form a relay team, or just make a course and do it together. I think that we're going to see a lot more groups doing tries together rather than last year as people are vaccinated and feeling safer about what they can do. So definitely flexibility is the name of the game this year, so make it your own. I want to take a moment. I'm going to get this background is distracting, so I'm going to take it off, but first I'm going to move out of the way. And I want to say thank you to all of our sponsors. Every business has been affected by COVID in some way. Oh, I'm blocking out Northern Light with my chair. Every business has been affected by COVID, and we are so grateful that we have actually the same level of sponsorship that we've had the past couple of years. So please, if you're able to patronize any of these businesses, don't hesitate to, because they have continued to make fighting cancer a priority. So thank you to them. And now I'll take that off, and Julie, race director and founder of Try for a Cure, can hop on.
Hi, I'm Julie. I am a race director, although I haven't directed a race for 2 years now. It feels kind of funny to be on the backside, and but it's still there. Try for a Cure is something that people look forward to every year, and hopefully everybody is looking forward to it again this year. So we're excited to have everybody here. We're most excited to have Danielle with us. I think, Danielle, how many times have you done the Try?
I only got to do it once in person, and then I did it virtually last year.
Ah, cool. Danielle is also having a baby very soon, and she started a company called Starting Line, and she's a physical therapist, so she wears many hats too. We're excited to have her here, and she's very supportive, and I know if you have any questions or anything about your physical being and how to get going, Danielle's a great person to be talking to. So I'm just going to let Danielle take over and share with us what she has for us tonight.
Awesome. Thank you so much for having me today. I'm going to go ahead and share my screen, and then if there's any trouble hearing me or seeing things, just let me know. But we should be good to go. All right. So I'm just going to. All right, can you guys still see me?
Yep.
Okay. All right. So yeah, so today there will be time at the end for questions, so you can submit them in the chat box as you think of them, and I'll go back and look at it. Or you can just wait to the end, and you can always pop on screen and let me know your questions then. But basically, it's just getting started with training. So just where to start, what to include, focusing on rest and recovery, and all that fun stuff in between. So just a little bit about myself. As Julie said, I am a physical therapist. I'm also a running and triathlon coach, and I'm an endurance athlete myself. It's in fact how I met my husband, training for the Boston Marathon in 2015. And then that's something that we both continue to share as hobbies of ours. I do own Starting Line PT and Performance. It's a physical therapy company and an indoor run studio. We also offer performance coaching, so for running and triathlon, and kind of everything in between. So anything from injury to performance, we have got you covered. So today, what I'll be focusing on is discovering the importance of warming up and cooling down, what that should include. There's a lot of flexibility there, but giving you some tools to work with. Optimizing your recovery days to keep you healthy throughout your training. Learn the benefits of strength training and what that might include. And then being able to detect warning signs, when to seek help if you are dealing with any injuries or discomforts as you're training, and how you might be able to make some modifications. So before we get into it, I just want to bring to awareness, this isn't to startle anyone, but that the injury risk for runners and triathletes is rather high, unfortunately. So about 50% of runners get injured yearly. And at any given time, 25% are injured. So anywhere between, we'll round that up to 20 to 80% incident of injuries seen in long distance runners. So despite all the things, there's still certain things that we can't fully prevent, although there are ways, which we'll discuss today, on how to decrease that risk. And triathletes don't get away completely uninjured. They are still getting injured, even if there is that multi-sport aspect, which does help decrease the repetitiveness of activity, but it is still prevalent. So once again, not to startle anyone, but more just bring awareness to it and give you the tools to help decrease that risk as you train this year. So first, starting with warming up, I'll play the video as I talk through this. I can also share this link in the comments at the end, it's a YouTube link. But basically, warming up should be dynamic in nature. So longer the days are of static stretching or prolonged holds, it really should be focused on improving, working through range of motion, being more specific to the activity you're about to do. That's where skipping is great. It's basically just a different variation of running. And for some people, they just kind of like that feeling of going through different motions, opening up the hips, working on your thoracic spine. That's what this one that I just did in the runner's lunge to rotation. So there's a lot of different ways that you can warm up your body. These are some of my favorites. They're by no means mandatory, Something as simple as fitness walking can absolutely do the trick. So finding whatever combination of movements work best for you is great, as long as you're doing something so that you're not going into the activity cold. Although this is technically more specific to running, there's no reason why it can't be applied to your bike ride or even your swim. Something like the, inchworm to mountain climber, or the runner's lunge with rotation into downward dog for like pre-swim, starts to open up the chest and your rotation, starts to get the low back a little bit. So like I said, these are by no means all inclusive of the types of warm-ups you can do. I just find that it hits kind of all the areas that you'll be using with those sports. As far as a cool down, once again, this is just some of my favorites, hitting the spots that I feel I really like to focus on after a run, especially after a longer bike ride, as those times they start to get a little bit longer. As far as running goes, you can simply, once again, just end with a 5 to 10 minute brisk walk to allow your heart rate to come down, to allow your body temperature to come down, to catch your breath. And just by doing that walk after the activity that you're doing, it starts to initiate that recovery process, which is huge. So if we look here, something like this is just going to help cool down the spine, so getting spinal movement to the low back and thoracic spine. For me, this is one of my favorites, stretching out the low back, especially as you're getting adjusted to being in the saddle again. Low back might feel a little sticky afterwards. Thread the needle is one of my favorites for thoracic mobility, so mid-back mobility and getting in between your shoulder blades, which might feel great after swimming, or after, if you're going into just from holding the handlebars, your mid-back might be a little tight. And just elevating the feet is a great way to just help that blood flow return to the heart and and flush the system out. And most importantly, rehydrating and enjoying it. So that brings me into recovery and why it is so important. So it isn't just what you're doing immediately after your workout itself, but what you're doing on a more regular basis throughout your training, the consistency of it. So stuff that you do every day, sleeping. It's recommended that at least 8 to 10 hours of sleep at night is going to be most optimal for recovery. We eat every day. So it's not just what you're eating before your workouts and after your workouts, but making sure that you're having a well-balanced meals throughout your week, whether you're working out or not. But areas of focus is at least 30 to 60 minutes after your workouts, focusing on prioritizing carbohydrate and protein intake is going to help with muscle recovery. I'm not going into too much depth on nutrition, one that is not my specialty or background, and that could be a whole presentation in itself. But in just a moment, I will bring up some more numbers that are specific to the demands of female endurance athletes that might be applicable or helpful to help guide you on the food intake you should be targeting. As for hydration, hydration is a really key piece, especially as the temps start to increase. It's recommended that about 2 liters of water a day, but one of the things that I like to recommend is making sure that you're also supplementing it, especially around your activity time, with something that has electrolytes in it. So that could be Noon tablets, that can be Tailwind, Scratch. There's a lot of different brands out there. One of my favorites is Noon. It's pretty easy. For me, it's easy on my stomach, which is always a nice thing to not have to worry about mid-workout. Lots of fun flavors. easy to travel with. But what the electrolytes do is helps replenish your electrolyte stores, which get depleted when we're sweating. So if you're someone that you know you sweat a lot, there's nothing wrong with that, but being mindful that you might require a little bit more replenishing of those electrolytes through supplementation versus just drinking water, which can actually, if you're just drinking water alone, it's going to actually flush the system out a little bit and not properly rehydrate you, especially on those really warm days. So just something to keep an eye on or be mindful of. So then here we have just some of the numbers here. I'll leave this up in case you want to take a screenshot. This is from an article regarding nutrition recommendations for the female endurance runner specifically, but can easily be applied to triathletes as well. So it just kind of goes through the energy intake, the protein per grams per kilogram. So kilogram is if you take your body weight and divide it by 2.2, then you can help kind of figure out the math from there. So something to just keep in mind, iron actually plays you'll hear it when you get your blood work done. Oh, if you have low iron, XYZ. The reason why it's so important is because it plays a role in supporting the function of proteins and enzymes that are essential for maintaining your physical and cognitive performance. So if you're low on iron, that's what can contribute to like that fatigue feeling or feeling sluggish, which obviously can be inhibiting or prohibitive, if you will, when it comes to training. If your iron levels aren't in that normal range, you're not taking in enough iron, then you might, as a result, experience some more fatigue when it comes to training, which isn't always fun. So if you're experiencing those symptoms, reaching out and getting blood work from your doctor, and then possibly reaching out to a registered dietitian to help guide you on how you might be able to increase your iron intake may be helpful. So now that we've talked about warming up and how you can prioritize strength training, recovery, we're going to go into a little bit of strength training. So strength training is one of those things that sometimes gets left out, especially with triathlon, because you're already doing 3 sports. So it's like, holy cow, how can I possibly have time to do something else? But I'm here to encourage you that even doing something as simple as 15 to 20 minutes twice a week, so tacking it on after a shorter run, or shortening a bike workout a little bit and doing 15 minutes of strength can really make a difference in helping to supplement your training and help things feel good. By getting things stronger, it's not only going to improve your movement economy, it's also going to reduce or delay your fatigue. It's going to improve your anaerobic capacity, possibly even enhance your maximal speeds. But most importantly, and this is where it comes into play of decreasing the risk of injury, is that it increases the tissue tolerance to load. So especially as it applies to running, if the muscles that you need to run, if you're strength training them in addition to using them when they run, that tolerance starts to build so that you can withstand more load, if that makes sense. And I'm happy to clarify anything at the end if you have questions. But ultimately, you can't go wrong with adding a little bit of strength training. And I'm going to give you some tools on where to start. So I'll kind of let this play through and kind of talk through just some of the basics. Once again, I can share this video as well. So I like to keep it really simple. We don't need to overcomplicate things as far as the exercises that are prescribed. So these are kind of my essentials that I think are important to include, including a squat, a deadlift. There's a couple different variations that I go over here. Strengthening the glutes and hamstrings. Squats are going to get glutes and quads. This is doing it single leg, which is also going to help work balance and pelvic control. I like to do things barefoot because you get the added benefit of also strengthening your feet. That's a personal preference of mine. Then we have a step up. That's also going to strengthen the glutes and the quadriceps. You can progress it by adding a march, which is also going to challenge your balance and, once again, your pelvic control. And when I say pelvic control, I mean, you'll see it in this view once I go into the march, trying to keep my hips level. So that's also going to target the gluteus medius, which is the side muscle of your hip that helps control your hips while you're running. So imagine this is my pelvis. When you're striking, you don't want to necessarily see that hip drop down. You want to have it stay relatively level as those legs swing through. Then calf raises. These are definitely a staple, because what a lot of people might not know is that a lot of load that we accept while running is actually accepted through our gastroc and soleus, which is our calf complex. So making sure that those are strong in addition to what we're doing when we run is really important. Once again, so marching, similar to that step up with a march, this is focusing on that pelvic control, coordinating that reciprocal arm and leg movement, and single leg balance. This one I like for triathletes, reaching overhead, because it helps with that mimic that elongation when you're swimming. So getting used to that movement pattern. Kind of skip ahead. Got lots of marching variations that you can scroll through when I send this link. I won't make you watch the whole video. And then weighted carry. So this is a farmer's carry, holding it in both hands. This helps improve grip strength, but also it is also an abdominal or core exercise, because it's challenging you to stay upright. And it also provides an axial loading. And what that is adding load to the skeleton. So helping to improve bone density, which as we age starts to decrease. So that's another added benefit, because I know there's a lot of age ranges that participate in Try for a Cure. Strength training is also going to help with any decreased muscle mass or bone density as we age naturally. Now the upper body pulls, this could be a row, a pull down, a pull apart. This is really going to be helpful for the swimming component of triathlon. So I show palms down pulling, palms up pulling. Like I said, you can go through this video, but this gives you a lot of exercises. And if you were to put an exercise, a workout together, pick maybe 3 or 4, go through it 3 rounds. Typically, I'll go to the next slide that goes through the rep scheme that you can go by. So you can make your own little workout. So typically for endurance athletes, it's not about doing, you could progress to going really heavy, but if you've not lifted before, starting really simple with body weight bands and then progressively increasing the load, it's okay. Like, you don't have to be nervous to grab a kettlebell or a dumbbell. And if you don't have access to those things, there's a lot of things around the house, like putting stuff in a crate or putting books in a backpack and wearing the backpack when you squat or do step-ups. There's a lot of creative ways that you can still get that load, because if you're just doing the same thing over and over again without any load, your body's going to adapt to that eventually. So we want to make sure that you're able to progress. So typically for hypertrophy, which means getting the muscles bigger or stronger, but you're not going to get bulky, don't you worry. Anywhere between 3 to 6 sets of 6 to 12 reps at 67 to 85% 1 rep max. So if you were to lift the heaviest weight possible for only 1 rep, you can do the math there. You don't have to think about that if you are just starting out. All you have to worry about is finding a weight that you feel comfortable doing, doing up to about 12, about 3 rounds. And then if that starts to get easy, then you know it's time to increase the weight to something a little heavier. As you increase the weight, you might want to decrease the repetitions, just so you're not trying to make too many things, change too many elements of it. All right, so no one likes to deal with any pain or injuries while training, but as we learned earlier, it isn't completely preventable, but we do the best that we can to decrease our risks. So let's say you are starting to feel some discomfort. I'm going to walk you through how you can detect some of the warning signs, what type of levels of discomfort are okay to train through, and when it would be appropriate to seek help. So just some things that I think are helpful to ask yourself when something might pop up is, are you having that discomfort during the activity, whether it's swimming, biking, or running? Does it immediately go away upon stopping that activity? If not, how long does that discomfort last following activity? Is it less than 24 hours? Is it 24 to 48 hours? That helps to give you more information in regards to the severity of it. So if it's resolving pretty quickly in less than 24 hours, okay, we're working with something that's a little less irritable, if you will. If it's lasting more than 24 to 48 hours or more, then we're dealing with something that is a bit more irritable and might require some more time off in between the next activity, and likely would indicate seeking some help. Are there daily activities that are also impacted by this discomfort or make it worse? Or is it primarily just during sport or hobbies? Is it something that's impacting your sleep? And then what would you rate the severity of your discomfort? So these are all questions that I would also be asking a patient if they were coming in to see me, but this is a great way for you to almost like pre-screen yourself to see where you're at, and help you make that decision whether or not you should reach out to someone. Because the last thing that we want is that you wait too long and then symptoms might get worse, and then it gets closer to race day, and then you're like, I don't know if I should be participating or not. So honestly, it is best to just reach out, ask some questions, and see what the next steps include. So this is just a nice pain scale that I like to use. It's adapted from the Wilks classification scale. So stage 1 indicates that you have pain on exertion, which isn't always a reason that you have to stop immediately. And I'll go into kind of the red light, green light boundaries that I educate patients on in just a moment. But just because you have pain on exertion doesn't always mean that it needs to be, 3 weeks off from activity. If it's something that is altering your mechanics, causing you to limp, or you just feel like you're not running, walking, swimming, biking the same way that you typically do, then that would be a red flag then leading you down the path of reaching out to a provider for help. If you get to stage 2, pain at rest, that also is an area where you might still be able to modify your training and continue training on without necessarily taking a significant time off. Because pain at rest sometimes could be just because you just ran and then now you're sitting at the table doing work and that soreness is just still present. But if it's so much so that it's preventing rest, like sleeping at night or it's waking you up at night, that would be more indicative of a red flag. Stage 3 would be pain with daily activities. Once again, is kind of that like gray area a little bit, because sometimes it could only be when you're walking, but it might only be some days, the day after you do your activity that aggravates it, but then the other days you don't have pain. So that's still kind of a gray area where you might still be able to train around it. But if it gets to the point where you're avoiding those tasks, you're no longer walking your dog for as long, or you're not taking the stairs at work, or whatever it might be, that's an indication that it likely is something that would be helpful to get checked out. So this is the red, yellow, green light boundaries that I like to give patients so that they have a little bit more insight as to how to make better game time decisions when something happens mid-activity. So if your discomfort is between a 0 to 3 out of 10, that's a fairly low scale discomfort. Maybe it's more of just an awareness. It's not causing you to limp or alter your mechanics. So this is the green light. So you can carry on, continue to do your activity, so long as it's not worsening or as you continue with your activity. As we get into the yellow light, that's like a 3, 4. Sometimes you might sneak into the 5 zone, but once again, if it's remaining stable and it's not worsening as you continue on with your activity, and it's once again not altering your mechanics, still okay to carry on. It's when we're creeping into that 5, 6, 7, 8, 9 area that I want people to stop. That's the, okay, I'm going to walk home. Okay, I'm going to call an Uber. Okay, I'm going to take a break and get this evaluated. You don't necessarily want to be getting into that red zone and then having to figure out how to play catch up and recover after that. So just a little way to give you some insight so that if something does happen mid-activity, you can have better decision-making skills moving forward. So some things these are just some tests that I like to take people through to see if they are ready for running. So if this is something where you're like, I don't know, can I do this? Should I run? Should I not run? And you haven't consulted with someone yet, these are just a little tests that I like to take people through and see if they aggravate their symptoms at all or if they have difficulty. So single leg balance, a lateral step down, calf raises, being able to do at least 25 on either side, bridge with a straight leg raise, so being able to hold the leg up and then straighten the leg, the opposite leg out, keeping things level, side plank. Pogo jumps is just jumping in place like you would, as if you were jump roping, hopping in place on one leg. So these are the two. If these other ones just give me insight as to where your strength is. Isn't necessarily a deal breaker if you can't do a certain amount of reps. It definitely gives you insight as to areas of strength to work on. But these two right here, these are plyometric activities. So if these are difficult to do or are reproducing the same symptoms that you're experiencing, then there's a good indication that perhaps running right away isn't necessarily appropriate at that time. And if you aren't currently seeing a PT about it, then seeking help might be beneficial. So these are just some ways. So this is referring to if you're in that stage 1 or 2, if the discomfort is staying in that green and yellow zone. These are some modifications that you can make to allow you to continue training and not completely take time off, if you kind of check all of those other boxes. So identifying what triggers your symptoms. So what exercises, what daily activities. For some people, it might be sitting at their desk all day. For others, it's going up and down the stairs. So identifying so that you can not necessarily eliminate them, but minimize them. How can you, if it's sitting all day, okay, how can you break up your day so that maybe you have more standing breaks? You can modify your training load. So if you're running, walking, or if it's biking that's bothering, how can you maybe shorten up those activities? If you're running and running bothers it, maybe you go to a walk-run program. If it's swimming, okay, maybe getting your swim stroke assessed could be helpful. Maybe it's something that's going on there. So there's always ways to modify how you're loading that area that's aggravated, whether it's through mechanics or bike fit or just shortening up, which goes into decreasing running, biking, or swimming frequency, intensity, or duration. So if out of saddle, if you're doing something on a spin bike, out of saddle or increased resistance is bothering you on the bike, then try doing a bike ride that's more consistent throughout and less intense on the resistance. Adding more rest. So this brings us back to the principle of prioritizing recovery. Understanding that a little bit of discomfort is okay, especially if it's resolving within 24 hours. Finding substitutes for exercises that you do tolerate. So if squats bother you, try doing a deadlift or a bridge. And that's not to say that you have to take out squats forever, but more so for this temporary period of time, doing things that feel better and then gradually working those back in. So gradually reloading the tissues and then increasing the activity as tolerated. So the last thing that we want to do, and I know it's specific to running injuries, but and running, because that seems to be the most common injuries or activity out of the three that people experience, is the last thing you want is to try and push through it. So if you're to a point where the pains are being managed with medication, so you're pushing through and you're like, oh, I have to take Advil or Tylenol before my run, that's a red flag in itself. So if you're having to take this medication in order to do an activity, likely maybe we need to reevaluate doing that activity. So that would be another indicator of like, it would be helpful to seek help. And then if you're at the point where you're describing it as crippling pain, that's also a red flag just by being in that stage. So once again, would be an indicator to seek help. Some other things, just in summary, when to seek help. If the pain is greater than 5 to 6 out of 10 and happens to be worsening and has been present for more than 2 weeks. Sometimes we just get these little things that pop up. You take a couple of days off and it goes away and you never feel it again. Bodies are weird like that. Pain is weird like that. So if it's been persistent and consistent for at least 2 weeks, that would be an indicator to seek help. If it's causing you to change your running mechanics, if you're having pain at rest or it's preventing you from sleeping, if it's limiting you from just performing day-to-day tasks, if you've had to modify your training schedule, so taking at least 2 to 3 days off per week, that would be an indicator. If you know that there was a specific mechanism, so if you tripped and fell, if you rolled your ankle, if there is some other specific mechanism, then that, that might be an indication to seek guidance. And then most importantly, if there is redness or visible swelling, that's likely something that isn't worth trying to train through. No one needs to be a hero. The sooner you get help, the sooner that, you hopefully have a game plan to work with to get things back into training. So these are just some resources. I can always send them, but just some resources that I like for runners and triathletes to take advantage of. And then that's about it. So if you have any questions, I'm going to stop sharing. But yeah, if you have any questions, I'm going to just get out of the slideshow here. And I will post those videos in the chat in case you guys want to go back to those at all. But yeah, if you have any questions, feel free to either turn on your mic or post them in the chat.
Danielle, I have the worst hips, and I feel like that's just the reality for women as we are runners and we, have been running for years and years. And I know I'm not old, but I'm getting older. And what are some of the common things to watch for with hips in particular? Or
do you have anything like that of in particular?
I feel like they're always just tight, and I always have a hard time getting going. So I have looked up like hip openers, but I didn't know if you had any tried and true for runners in particular.
As far, even doing the warm-up series, if it's like a feeling of tightness, like kind of getting started, but I always bring it back to strength training. And if you aren't implementing strength training or haven't already tried to initiate that or incorporate that into your training, that has helped so many people. Hips, knees, whatever it might be, is just one way that you can help supplement the training so that it's not just the repetitive motion of biking, running, swimming, which in nature, that's just the nature of the sport. It helps to train and strengthen those muscles that we use during those activities in a different way by introducing a new stimulus. So if that's something that you haven't necessarily explored fully, I think that that's something that is worth exploring, and I'm happy to help you through that.
Thank you. Yes, I feel like I'm a lazy runner. Like I want to run and then be done with it. So this has been very helpful to remind me that I need to step back and look at the whole picture.
You're not alone in that.
So I have a quick question.
Yeah.
Sometimes when on a bike ride around 5 miles or so, I'm not a pro bicyclist at all. So my hands kind of go numb and tingly a little bit, and they end up stopping when I'm done. But during the activity, I'll shift my hands to the side of the handles, and it kind of helps the numbness. But is that maybe the way I'm positioned, or is there something I can do to help strengthen something or stretch something differently?
Yeah, so I used to experience that as well, and I think there's part of positioning to it, but also I used to grip my handlebars so tight, and I think that playing around with just being comfortable, loosening up my grip, definitely helped to decrease that a little bit. But also I do have like handlebar, like do you just have like a mountain bike where you're like this, or do you have the handlebars that curve?
It's more like a mountain bike, straight bar style.
Straight bars. Yeah. So with the straight bars too, if, let me get something to grip. I have a ruler. So if you're here, if you're keeping your hands more neutral, that's going to kind of put the structures here. So we have our muscles, but we also have a nerve here. If you're more here, it's going to put all of those on stretch. And then if you're more here, it's going to compress that area. So if you're kind of coming over the handlebars and closing down there, that could cause some compression, which could also contribute to the numbness. If it continues to happen and you've messed around with loosening up the grip or changing your hand positions, it could be helpful to get a bike fit if you haven't done that before, just to make sure that you're not overreaching and things aren't too, like the seat's not too far and things aren't too low. That might give you a little bit more insight as well.
Okay, great. Thank you.
You're welcome.
I had a similar problem too, and in addition to what you just mentioned, Danielle, I got some gloves that have padding like in the hand, the palm, and it made it a lot better. So yeah, worrying about my hand position and then gloves.
Yeah, no, that is a great point, because we do, I mean, our nerves don't just like stop at our wrists. It does go through, and sometimes just that like reverberation of just like the not big impact, but a little bit can just kind of hit those nerves the wrong way. Kind of like when your hands or feet fall asleep when you're sitting in a position for a certain period of time. So, excellent. Anything else? I'm just throwing my email in there too. If you have any questions, you can always shoot me a note.
Super. And I will send this out to all the Tri participants in the Tri Talk next week. So
Great.
Stay tuned if you guys want to watch. I've been recording it. Hopefully it all works out. I never trust myself fully with technology, but we will make this available. So if you want to rewatch it, you can. Cool. Well, thank you so much, Danielle. Thank you. This is really helpful, and I'm glad that we can go back and review it. A lot of information to digest. So,
Thank you, Danielle.
My pleasure. Not a problem.
Have a good night, everybody. Take care.
Thank you.
Bye.